I'm Magda Boulay, and I'm a physical therapist, and I also do Pilates for health and wellness. So my business is Pilates, physical therapy and Pilates, and I provide rehab services for injuries and for those individuals that only they want a more of an overall wellness program. I also provide exercise and Pilates to address those needs to prevent injury and keep people healthy and strong. And I'm here to explain why I chose to combine those services. I get that question a lot, and basically in 2005 I graduated from PT school. I took the boards and passed and got my first job, and I worked in a traditional model outpatient services clinic for many years in different settings, and I did a little bit of inpatient rehab too, but I loved working in outpatient and I love being a PT, but there are many things about our traditional system that I don't like. One being that our system values quantity over quality. We were pushed to see too many people, too many people during the day. Some places would want the PTs to pass the patient or client off to aides and still be charging for those services. I did not agree with that kind of that model of that value. I believe that we are highly trained and skilled, and I want to be able to treat a person individually and be able to observe them and provide hands-on, whether they need hands-on treatment, or also be able to be present and involved with watching them move and giving them the appropriate exercises and cues and being able to progress that myself versus not having a full handle on that. And I also disagreed with insurances being able to dictate who was going to be getting services, feeling like you're begging to be able to just try to make people better. And so I've opted to open my own cash-based practice, and I don't have to do that anymore. I can provide transparency for the individual. Everyone knows before they come in exactly how much my treatments or my sessions will cost. They're not going to get a extra bill, 6 months down the road that they didn't know they were going to get. I also am able to treat people for longer. Instead of seeing someone for 20 or 30 minutes, I can see them for an hour, or if I have time, even longer. Again, they will get the quality services that I feel like I can provide. And so it actually sometimes may work out in the end to be almost more cost effective, considering the amount of time that I'm able to spend with people. I think I'll be able to get people better more quickly because I have the advantage of being able to do what I feel is appropriate, and thus people will be able to progress faster. Again, the combination came into play when I was in the traditional clinic. When you only have a few visits with someone, you're focused in on getting the pain under control and getting the person as pain-free as possible. And I felt like I was pretty effective at that. But when you have a limited number of visits with someone, you again are focused in on more gross things. Get the pain under control. Get that baseline stability, versus a lot of fine tuning. And our system, our traditional medical model, does not allow someone to be seen for the number of visits that you would need to not only do the gross assessment and getting people's pain under control, but also continuing to fine tune and fix movement abnormalities or strengths or weaknesses, not strengths, but weaknesses, or you know, in flexibility, stiffness, that if someone is being seen for Pilates or a wellness program, which is can be an extended time if a person elects to do that, I'm able to not only, if someone has an injury, now I can see them, I can get their pain under control, I can tell them, you know, educate them on what's going on, and then once they get better quickly, then if that person elects, they can also continue a more of an overall body program addressed at specific movement or abnormalities and postural things that movement abnormalities that I observe with them, and then work on that over time to continually improve these imbalances and weaknesses, and hopefully get their body in a better alignment, with improved stability, and hopefully prevent these things from coming back, because a lot of injuries happen from chronic and repetitive stress over time versus something that might be acute. Again, we see everything, but a lot of people's aches and pains are from poor practices, and now I have a practice where I can help people address these issues and improve them to their capability, and so it's nice.